So the skin is made of 3 layers, as I named them here. The epidermis is the outermost layer. It's really your protection for your body. It's going to block bacteria and germs and things from getting into your body where they can wreak havoc, right? The epidermis also helps create your body temperature. It keeps you warm when it's cold outside, and it protects you from injury and stuff. So imagine if we didn't have skin, right? We'd have be exposed to all kinds of things. So epidermis is very important. And then the dermis, that's really the thickest and most active area of the skin. That's where all the blood vessels are that bring oxygen and nutrition to your skin, and the veins that pull away, the waste products to be excreted from the body. It contains glands that produce sweat and oils, and also the roots of hairs, which your entire body is covered in hair. A lot of it you can't even hardly see unless you look really, really close, right? And there's muscles in there called pili muscles, I believe, sorry. And those are the muscles that contract or relax depending on the temperature outside, and that can cause you to have goosebumps, right? Makes the hair stand straight up. And that actually can produce sort of like this outer layer where the air between the hairs is kind of warmer, right? So that's your body's attempt to warm itself up by the use of your skin. And then the epidermis is your subcutaneous or fat layer. And I think we think of subcutaneous mostly with things like, administration of certain medications like insulin and other things. But those are the layers of skin that are often involved in wounds or minor injuries. So what is a wound? A wound is an injury to living tissue caused by a cut, blow, or other impact, typically one in which the skin is cut or broken. And I put down a whole bunch of synonyms to wound, which I was amazed when I actually looked it up. There was all kinds of things, right? A wound can be a lesion or a gash or a laceration, or a bruise is even considered a wound because it's damage to the tissue, abscesses and ulcers and all of those things. So first we're going to talk about cuts and scrapes. These are minor injuries that can generally be treated at home using first aid. And I know that DSP staff are all required to have first aid training. So you guys have already been taught this, but I thought it was important to, as the foundation here, to have the first aid procedures kind of summarized here. So probably the most important thing if you're going to be providing care to somebody who has an open wound of some sort is making sure you wash your hands really well, right? And then stop the bleeding. Now, if it's gushing, please, work on stopping the bleeding, and you can deal with the hands later. But if someone comes up to you and says, oh, I scraped my arm, I'm bleeding, wash your hands first, because of course, if you touch somebody's open wound with hands that are not clean, there's going to be a much higher chance of infection. And then you want to clean the wound. Most wounds are going to stop bleeding right away. Takes about 30 seconds or so for the body to clot a wound and stop bleeding from capillaries and such. If a larger vessel is involved, then there may be more blood. And if that's the case, then, you can apply pressure to try and get that to stop. And usually it will stop after a couple of minutes. But once the wound is nice and clean and the skin around it is nice and clean, then you can pat it dry with a paper towel or something, and then apply an antibiotic ointment or some petroleum jelly. And that just really creates sort of a barrier there that's going to keep the fluids kind of in the person's body, and then it's going to protect it from other things getting in from the outside, but also antibiotic ointment like Neosporin or triple antibiotic ointment is going to help prevent infection, because usually when somebody has a scrape or a cut, it's been scraped or cut on something that's not clean. And then you're going to cover the wound. So small wounds, you throw a Band-Aid on there. Some are bigger, and so it's good to have some larger dressing supplies available, whether it's gauze or sometimes you can get self-sticking kind of dressings and cover that up. And then the next thing is that you want to be sure you're changing the dressing, like maybe every 12 hours or once a day. Once a day is kind of the base rate of changing dressings, mostly because, as you know, if you've got a Band-Aid on or something, it's typically going to end up getting wet or dirty through the course of the day. And so we want to take off the yucky old dressing and put on a new one. But every time you change that dressing, you're going to go through this same process. You're going to wash your hands. You're going to take the old dressing off. You're going to wash the wound lightly, gently, and then put your ointment on and then cover it. The seventh thing you might need to do is get a tetanus shot. This is anytime if the wound was caused by something that is dirty, or there was dirt or debris in the wound when it happened. If you are chopping up veggies in your kitchen with a clean knife and you cut your finger or something, you don't need a tetanus shot. But they say that tetanus primarily grows in the dirt or in the ground. So you would definitely want to consider a tetanus shot if it's been more than 5 years and you've got a deep or a dirty wound. And then watch for signs of infection. So anytime you're changing that dressing, you're going to check it out and make sure there's no signs of infection. But you may notice too, if there was infection, soilage on the dressing that's discolored, or redness in the area. But we're going to talk more about that here in just a second. So a lot of people ask, when does a cut need stitches? And I found this information online. If you're ever not sure about an injury, you can easily Google this. This came from an urgent care clinic that had it posted on their website. When a cut is deep, meaning more than where it's obviously through all the layers of the skin, and it doesn't close up easily or continues bleeding, right? If it's more than ½ inch long, if the edges are ragged, or possibly if it had debris in it, you might need some sutures. If it's bleeding through the bandage, even after applying pressure for 10 minutes, it probably needs stitches, because probably you've got a larger blood vessel that's been damaged. And if the cut was caused by a pointed object, that's like a puncture wound, it's probably deeper than it appears, or it was caused by something dirty, or an animal or human bite. Doctors recommend getting stitches to avoid infection. So when you go to the doctor for sutures, they clean it out really, really good, and then they'll stitch it up, which helps stop the bleeding and also prevents more germs from getting inside. And the location of the wound is important too. If it's in a large wound that's in the mouth or on the hand, which is very mobile, if it's somewhere on the face, stitches are important. We don't want big scars on the face, and sutures can certainly prevent significant scarring. If it's around a joint, which moves a lot, right? So every time you move, it pulls open kind of a thing, you might need stitches. And certainly if it's near an eye or on the genitalia. Okay, wound infections. So this wound you can see in this picture, it doesn't look good, right? The whole shoulder, I think that's a shoulder, is red. The skin looks tight, like it's swollen. It's got some drainage. There's that weird yellowy color. That wound definitely looks infected. So what are the signs of infection that we're going to be watching for? The first sign is usually the increase of pain at the wound and around the wound. Generally, after a pretty short time, wounds should feel better, right? But if they start hurting badly again, that's not a good sign. So, and any swelling, and especially redness of the skin around the wound, or if you ever see a red or purple streak coming from the wound, that is a sign of infection. When I was a little girl, my dad used to always call it, blood poisoning. If you had a line going up your arm toward your heart, that was blood poisoning. But, yes and no, it was just, it's infection that's kind of moves its way up through the vein, and it is heading toward your heart. And that, of course, is how people end up with complications from wound infections. If the skin is very hot and very warm, and then, of course, an obvious sign is going to be any yellow, green, or opaque discharge coming from the wound. And if you don't know what opaque means, it means that you can't see through it. It's not translucent. So, it can be white, tan, brown. I've seen all kinds of colors. It's a rainbow of colors of discharge that can come from an infected wound. If the wound is giving off a gross smell, that's not a good sign either. Definitely, I would be concerned about bacteria. And then, of course, with a severe wound infection, you could even have fever and chills and achy all over and pain or nausea and vomiting. So any of those signs of infection would be a reason to help somebody to seek medical care so that they could have it assessed and get on an antibiotic. Risk factors for wound infection. So if the wound was not cleaned real well before the dressing was put on and there was maybe some debris or dirt or germs left in there, that, of course, is going to be a huge risk factor. Now, granted, your skin and your body fights bacteria. And so, there's always going to be some bacteria because we all have bacteria all over our bodies. But if you don't clean it real well, you're definitely at a higher risk. If your hands, if you're the person putting the dressing on the wound, are not clean, or if the supplies you're using are not clean. If you're trying to stop bleeding, it's best if you're not grabbing like a really dirty cloth or a used dish towel or something like that to try and hold pressure on an open wound, right? Because you're just introducing germs into that area. So if you are using other supplies that might not be dirty, maybe old dressing supplies that have been kept under the bed or something, that kind of thing. You want to make sure your first aid kit and all of your supplies are together in hopefully like a little locking box, not like a padlock, but like, that it closes securely and keeps germs out of there. Certain types of wounds have a higher risk of wound infection. And that's going to be, of course, anything, like we said, that has had debris or dirt or anything inside of it. But also, a wound that's caused by an animal bite, is going to be much more likely to get infected. And as a matter of fact, if you ever have a client in care, or yourself or your family for that matter, who gets bit by an animal, you definitely want to go see a doctor if they've punctured the skin, right? Because the mouths of animals are full of really nasty bacteria, and puncture wounds tend to not drain real well. They don't bleed a lot. And so those germs kind of stay in there. And most of the time, if you've been bit by something or even scratched, the doctor is going to try to put you on some antibiotics just to prevent it from getting infection. Wounds in certain locations of the body also have a higher risk for infection. So any wound that is in an area that is prone to be hot or moist, like in the groin, or like the armpit, underneath the breast, and or under the belly fat of an individual, those are going to be far more likely to get infected, because the hot, moist environment is just a prime breeding ground for bacteria and fungus. And so those kinds of wounds need extra monitoring and some extra effort to try and keep the area clean and dry. Also, there are certain health conditions that put people at higher risk for wound infection. We talked briefly about people who drink alcohol, smoke cigarettes, those things that reduce the circulation to your skin. They're also reducing the circulation of your infection-fighting phagocytes or other white blood cells that wound needs to protect it from getting infected. People who have diabetes are going to be at higher risk because elevated blood sugar is super yummy to bacteria, right? Bacteria loves sugar. And so if a person's blood sugars are pretty high most of the time, or higher than normal, they're going to be more likely to get infections if they have wounds. Anything that affects the immune system, such as immune compromise, it could be that the person takes an oral steroid every day, or it could be, that they have HIV. So those types of things too are going to bump up that risk level for getting an infected wound. So complications of wound infections. These can be pretty significant. We're gonna go down the line of least to most. So any infection of a wound is going to delay healing. Wounds that have lots of bacteria in them, they also, bacteria is excreting toxic substances, and they're destroying the tissue of the wound. So as the body's trying to heal, the bacteria is destroying the healing that's occurring. And so healing can take a lot longer, or it can just be called a non-healing wound. Some people have chronic wounds, and part of the reason is because they have chronic infections of their wounds, and so their wounds just don't get, aren't able to catch up and overcome that. The next complication that we've seen often, of course, is cellulitis. And cellulitis is when the bacteria that is in that wound has now spread to the surrounding tissues, primarily the surrounding skin tissues. And because it's gone, under the skin, essentially, what you have is like that picture at the beginning of this section, where the surrounding skin is red and swollen and tight. And for some people, cellulitis can be very severe. It can be large in area, like if someone had a wound or even just a scratch or bug bite, like on, say, their calf, their whole leg, lower leg might get cellulitis, where the entire leg is swollen and hot and red. And I've even seen people with cellulitis that they had long enough that the skin starts weeping, and there's just fluid like coming out of the skin, because the skin has been broken down by the bacteria that's in it, and so the liquid that's in the body is just leaking out essentially. And of course that puts them at even higher risk of the next one, which is sepsis. Sepsis is a very strong immune reaction when bacteria gets into the blood and it travels throughout the body and makes the person very, very ill. And if you would like to learn more about sepsis, I recommend going onto our YouTube channel. We did a class on sepsis earlier this year. So if you're interested in learning more about septic shock and sepsis, go take a look, because that was a really great class. The next complication is osteomyelitis. So osteo means bone, and osteomyelitis is when a wound is infected and the bacteria gets into the bone, and now you have a bone infection. And treatment is usually IV antibiotics, but in some cases, if the bone is significantly involved, or the bone infection isn't clearing with prolonged antibiotic use, this is when you might see somebody who has to have part of their body amputated. Now, sometimes osteomyelitis is just a very small area, and they can just go in and remove the piece of bone that's dead or infected. But like in people with diabetes, who you may even know someone who's had to have like their toes or their foot or their leg below the knee amputated, it's because they had a non-healing infectious wound that got into the bone, and the only way to get rid of it was to go above the site of the infection and amputate. And then the last one is necrotizing fasciitis. The fascia is a thin lining that goes around the muscles in our body and over the bones and tendons, and in a way it kind of holds everything together underneath the skin. And sometimes when someone has a wound infection, the bacteria actually gets down and gets into that lining, and it's rare, but it is an emergency, because it can spread through that lining throughout the whole body and even cause an individual's death. So these are all, you know, kind of the big complications of wound infections, and why it's so important that we are monitoring wounds and making sure we're taking good care of them, keeping them clean, and you know, getting medical attention if we see signs of wound infections early on, right? How do we prevent wounds? Well, for cuts and scrapes and things, we are going to try to prevent injuries, because if we're all being really safe, then hopefully we won't end up getting hurt and having a wound. And of course, I've listed here a lot of the things that I know that you guys already help our clients with. Fall prevention. A lot of people end up with wounds because they fell and, hit their head on something sharp, or, fell onto gravel or fell downstairs, or, any of, you can imagine all of the scenarios, right? So implementing really good fall prevention is one way to prevent injuries and hence prevent wounds. Teaching clients animal safety. We've had several instances I can think of where a client has approached an animal that they didn't know, and just reached out to pet the dog or cat or whatever and got bit, and now they have a wound that's likely to get infected, and and that can be, of course, really dangerous. So it's important that we're teaching clients how to be safe around animals. Sharp safety, and we're not talking just needles. This is any kind of sharp scissors, knives, anything sharp that they might be using. How can they use those things in a safe manner, or how can we help them with whatever they need done so that so they're not using really sharp objects for things. Protective clothing and or gear. You're far less likely to get a big gash in your head when you crash on your bike if you're wearing a helmet. If you wear protective clothing, it can prevent severe sunburns, which can, of course, if they're stage 2 or above, they can cause blistering, which then ends up being a wound. Protective clothing also helps if you have a fall, if you're wearing clothing, even fairly thin fabric, because I know it's hot here, and the idea of wearing long sleeves probably doesn't sound very good. But if you take a fall and you have clothing on, you're going to have less chance of getting a wound, or at least less damage to the skin, because you've added a layer, right? Having appropriate shoes. This is really important for everyone. Flip-flops are not very safe. Most of the foot is exposed. You don't have much protection. They fit funky, and so you're more likely to trip or fall. And so having good shoes is going to make a difference. But most importantly, appropriate shoes are really necessary for individuals with diabetes, because they have multiple risk factors for getting sores and wounds on their feet. And having those really kind of thick and well padded and supportive shoes that fit appropriately, that's going to help keep their feet safe from wounds, or at least help prevent injuries to their feet, which are then more likely to get infected because they're diabetic. You can pad sharp corners on furniture and things. If you work with a client who has a tendency to fall or get unsteady, it's probably not a good idea to have really sharp corners on furniture and counters and things. But if they do, just taping some foam on there can be really helpful. Insect repellent when outdoors, it's going to help prevent insect bites, which can get infected, particularly spider bites. But any insect bite where the person scratches them and breaks the skin is going to be at risk of infection, right? Because their nails are probably not clean, and now they've gotten it into a bite that's been opened up. And then maintaining healthy skin. If we all pay attention to, basic hygiene, using a good lotion, and eating a nutritious diet, we can maintain healthier skin that's a little thicker, doesn't tear as easy, and things like that. Okay, so now we're going to move on to pressure injuries. And pressure injuries are very common in individuals who are stuck in bed for long periods of time, or who use a wheelchair for their mobility and are in their wheelchair for a long period of time. For our clients who don't move around real well, they can really have high risk of a pressure injury. And anyone who's had a pressure injury before is at the highest risk of having another one. So it's really important that we understand how this works and figure out what we can do to prevent them. So the way a pressure injury forms is you have the upward pressure, which is usually the bed or the surface on the chair where they're sitting or resting. And then the downward pressure is just the weight of the person and the hard surface of bone. And here you can see this drawing is of a person sitting in a chair. And this is their pelvic bone down at the bottom of the buttocks. And it's pushing on the tissue, right? We've got the bone, and then the red is muscle, and then you've got the 3 layers of the skin. And because the surface they're sitting on is firm, you know, it's not really bending to the shape of the body that's being created by the bone. It's just being squished in between those two. And what that does is in that small spot where the bone is pressing, there's no blood flow or very limited blood flow to that little area of the skin and the muscle. And if they're in that same position for a long time, and by a long time, I'm talking about as little as 15 minutes or, you know, even a few hours, they're really likely to develop at least a stage 1 pressure injury from that. I don't know that everybody realizes how often we actually shift our weight and move around when we're in a chair or when we're laying in bed. But most people, you know, we just don't even think about it. We just, you know, move around, and that's how we prevent ourselves from getting pressure injuries. But a lot of our clients can't do that. So this picture here has the 3 different laying positions. One is on the back, on the side, and then laying on the stomach. And it just shows with the red dots what the pressure points are on the body, depending on what position they're in. And those are the points that are most likely to develop pressure ulcers if they lay in the same position for too long. It's really important that care staff are aware of where these points are, so that when assisting clients, they can, you know, check those areas for any signs of a developing pressure wound. This picture shows a man sitting in a wheelchair, and again, it's highlighting the different spots that are getting the most pressure from sitting in the chair. Here, the scapula that's in the shoulder blade back there is pressing against the back of the chair. The elbow is pressing against the arm of the chair. There's 2 points on the bottom here, the sacrum and the ischium, that are feeling pressure. And then the ball of the foot and the heel of the foot. And those are where you're going to most likely see pressure wounds develop. But it's not uncommon to have pressure wounds develop even in the crease behind the knee, if they're sitting with the edge of the seat kind of pressing up against that spot, or even on the spine. For people who are really, really thin, you know, their spine is kind of sticking out, and those little bumps of bone can cause multiple pressure wounds if they're sitting or laying down in the same spot for too long. Okay, so this is a great picture of the different stages of pressure ulcers. So stage 1 is non-blanchable erythema, and erythema just means redness. Blanchable is when you, if you can do it right now, even on your arm. If you press on your arm with your finger for a couple seconds, and then you lift your finger, you'll see that it's white. And then the blood flow comes back to that area of tissue, and the color fills in and it looks normal again. So, I mean, obviously you can get redness just from having pressure in an area, and it's not necessarily constituting a pressure ulcer. But non-blanching redness, that's where when you push on it and you lift up, it doesn't turn white. There's no white there. It's just the same red color. And that is oftentimes a stage 1 pressure ulcer. And once it's, started, pressure ulcers tend to continue to get worse if something's not done to address whatever's causing the pressure in that location. Stage 2 is where there's actually some loss of skin, and it looks like a big chunk on this picture, but this is it's like the top layer of skin has come off, and it's red and angry underneath. There's generally no bleeding. It's just, it looks like the skin peeled off in that spot. Stage 3 means that the wound has now gone deeper into the subcutaneous tissue or into the muscle. And this one is showing it going down into the fat there. Stage 3 pressure ulcers are significantly harder to heal than a stage 2. And a stage 2 is harder to heal than a stage 1. So it's very important to catch these early to prevent the progression to these other stages. Stage 4 on the bottom left. A stage 4 pressure wound is one that goes down through the muscle to the bone. And these are very, very hard to heal. And if they get infected, you really run a high risk of getting osteomyelitis at that site. Now, you might have heard of a deep tissue injury. A deep tissue injury is one where you may not see any disruption of the skin, but it'll just be really dark purple or even black. And the fact is that most deep tissue injuries actually extend deeply and are underneath their stage 3 or even 4 wounds. But because it hasn't opened up to reveal what's inside, there's really no way to know how deep it is. And then there's unstageable wounds. Unstageable wounds are wounds where this black tissue is there at the site of the wound, and it's basically damaged to all the layers there, or some of the layers, but it's kind of this hard scab-like material that hasn't come out yet. And so again, there's no way to know without debriding it or removing that dead tissue. There's no way to know how deep it goes. And so in general, when someone has an unstageable wound or a deep tissue injury, it's just assumed that it's a stage 3 or 4. So there are direct and indirect causes of pressure ulcers. And of course, pressure, like we talked about. But in addition to pressure, shear and friction can also lead to pressure ulcers and generally work in concert with pressure to cause the injury. And shear and friction are a little bit different. Shear and friction are caused by usually movement of the body against like the sheets on the bed when you're adjusting someone. So like if you're lifting someone up in bed and you kind of drag them up in bed as opposed to like lifting and then moving them and setting them back down, then you're causing shear. And it's like when you're moving the skin and the bone in two different directions. And what that does is it breaks the blood vessels that are feeding the skin and causes internal damage to the skin that you can't even see. But that when pressure is then applied, because maybe they're stuck in bed, there's more of a chance of getting a pressure ulcer because not only is there pressure, but there's also damage to the vascularization of the skin to begin with. Friction you can usually see, it's usually reddened and sometimes even some skin is peeled off, and that's from just constant motion or frequent motion back and forth against a coarse like fabric on the linens or on the cushion on their wheelchair or something of that sort. Immobility is a direct cause in that if the person can't move themselves, they, even though they might feel like they need to move because it hurts and is sore where they're sitting, if they can't move to reduce the pressure on their own, then it's just going to continue to get worse. Loss of sensation. This is anybody with a neurological injury, or for diabetics who have neuropathy, they can't necessarily feel that there's a problem. And so those folks they don't feel the need to shift their weight because they can't feel that something bad is happening. And then of course, combined pathologies. So if they have more than one of those. And then there's indirect causes. And we will talk more about those in a second. So these are the risk factors for pressure ulcers: having poor health and circulation, limited mobility, nerve damage, impairment of thinking and reasoning. If somebody can't cognitively put it together that, that something feels uncomfortable because they need to move, or, if they don't feel that their brief is wet and so they just sit in it, those kinds of things will make it much more likely that they could get a pressure wound because they're not able to take care of their own needs through thinking and reasoning. Poor nutrition. If you don't have a healthy diet, or you're not getting enough calories, and so you have very little fat and your skin is thin, you're going to be much more likely to have injury. And then unmanaged or poorly managed incontinence, because moisture definitely makes it a much higher risk that somebody will end up with a wound, but also with a wound infection too, if they're moist. So treatment for pressure injuries. The treatment really varies depending on where the pressure wound is, how deep it is, what stage it is, and what products are preferred by the treating physician. So they've come out with so many really cool wound care treatments. over the years, it changes, and certain doctors really love certain products, and so it just depends. So really, anytime someone has a pressure injury, they need to see their doctor so that they can have specific wound care instructions given, and if needed, a referral to a wound clinic where they would go in weekly or maybe even twice a week for wound care by the doctor and their team. At the doctor's office, they can get a referral for home health to come out and do dressing changes and monitor a wound. And then home health nursing also reports back to the doctor on how it's going, keeps that line of communication open. And also a prescription for any equipment or supplies. If somebody has a pressure wound, they probably need a special bed or other supplies, and they may need a prescription for pain control or an antibiotic. But the main treatment and the biggest focus should be on preventing pressure to the location where the wound is at. So like if somebody has developed a pressure wound on their tailbone, typically if they're bedbound, then you would just reposition them either on their left side or on their right side, and you would totally avoid them laying on their back at all, so that you could keep pressure off of the place where the wound is. Because if someone already has a wound and then you're putting pressure on it and cutting the circulation off, that wound is not going to heal, and it's probably going to get worse. Keeping the wound and the dressing and the surrounding skin clean and dry is very, very important. And this can be really challenging for people who have incontinence and their wound is somewhere around that area. And so, sometimes you'll see that an individual with a pressure wound, on their coccyx or sacrum will actually have a catheter placed temporarily just to try and keep moisture off of that wound. If the person is incontinent of stool, it's really important that, to keep stool out of that wound, off of that dressing. And if the dressing gets soiled, to change it. Don't leave a soiled dressing on a wound, because it's just going to breed bacterial infection. And then, changing the dressing per the doctor's order. A lot of dressings are made to be able to stay on a little longer with pressure injuries. There's some specialty dressings that, it's nice, clean, put it on, and you can just leave it there for a couple days, and then hopefully home health is going to be doing those dressing changes. For minor pressure injuries like stage 1 and 2, those are dressings that you could follow more along the lines of, that more of a basic dressing, but also changing it more frequently or when it gets soiled. Once you get into stage 3 and 4, whole nother ball game. That you might see some really advanced dressing supplies coming out, or you might even see somebody put on a wound vac, which I didn't add a bunch of information or any information for that matter on wound vacs, but wound vacs are like really cool, and they really help wounds heal quickly, and that's a special dressing that only a nurse or a doctor can do. Any dressings that require sterile dressing changes as opposed to clean dressing changes need to be done by a licensed professional. Sterile dressing changes involve a pretty significant protocol. You have to have access to sterile gloves and know how to perform that dressing change sterilely, meaning there's zero bacteria, germs in the environment, or on your equipment, or hopefully not even on the wound area. So sterile dressing changes would need to be done by nursing or by the doctor. Generally, if someone's going to wound care, they are getting sterile dressing changes. So we're at the top of the hour. We're 3 minutes over, and I apologize. I'm sorry for the technical difficulty at the beginning of the class today, but I'm going to stop here. And I know that people had some interest in learning about more about pressure injuries and prevention and stuff. So the rest of what I had on the slideshow for today actually focuses more on different types of equipment and stuff. And so we'll just have to have another class about it, because it's a big topic and there's all kinds of stuff we can talk about and share. So we will do that at another time. But anyways, thank you for your patience. I'm more than happy to stay on and answer questions if anybody has questions.